If you are thinking about having a baby, there's a few things that should actually be planned in advance to make sure that you're as healthy as possible. And if you're as healthy as possible, then research has shown that you and your baby will do the best you could possibly do during pregnancy. One of the first things you should do is schedule a preconception visit with your doctor. They'll talk to you about your overall health. They'll talk to you about health problems you might have had in the past. What's your family history? If you've been pregnant before, are there any risk factors that might carry over into this pregnancy? And they'll do what they can to minimize risk. One of those things includes making sure you're as healthy as possible. So if you have diabetes, high blood pressure, thyroid problems, those are just a few examples. Or if you're overweight, they'll want to do what they can to help you lose weight, get your hormone levels within a normal range, get your blood pressure within a normal range, and make sure your blood sugars are well controlled. And then if you go into pregnancy that way, then hopefully your outcome will be as good as it could be. Another thing to do is to avoid consumption of alcohol, illicit street drugs, tobacco, and also over-the-counter medications, prescriptions, and herbal supplements that aren't safe during pregnancy. And if you're not sure if what you're taking is safe or not, talk with your OB provider about it, and they can give you the best information and help you decide if it should be taken or not. Do take a prenatal vitamin each day, one that has at least 400 micrograms of folic acid in it. And as long as you have enough folic acid in your system when you get pregnant, then the chances of your baby having neural tube defects, specifically spina bifida, are very low. So that's a very important thing to do. And actually, women of childbearing age should take one whether they think they're going to get pregnant or not, because sometimes surprises happen. And that's a very important thing to have in your body when you get pregnant. Do what you can to limit exposure to radiation, toxic chemicals, and protect yourself against sexually transmitted infections. And if you're in a domestic violence situation, do what you can to get out and make sure you're in a stable relationship when you have a baby. Good luck with everything, and if you have more questions for me in the future, please feel free to ask them on our Facebook page at facebook.com/Intermountain Moms, and recommend us to your friends and family too.